everyone, and welcome to my YouTube channel. My name is Joanna the Nurse, and today I did a quick Q&A on Snapchat to answer some of your guys' most commonly asked questions, and I put it all in this book, the Book of Joanna the Nurse. Okay, my first question, tell me about your clinical days for nursing school. So for nursing school, I did a lot of clinical days starting after the second semester. I did well over 600 hours, I think, clinical hours. It was pretty tolerable, however, the majority of them were 12-hour shifts. So just a little warning for you guys, it is hard to work full-time if you are planning to go to nursing school, but it is, I guess, kind of doable. How long did it take you to become an RN? So it took me about 3 years. That was for the pre-licensure program, plus for my master's in nursing, about 3 years. I also did all of my prereqs in undergrad though, while I was getting my degree. But career, how to get there? Sorry, career, how to get there. So pretty straightforward to get there. Basically, just work hard, get some connections. And apply for a lot of med spas, plastic surgery offices. Most places are looking for someone with experience, so I do recommend attaining experience pretty much anywhere you can. Okay, non-surgical procedure to eliminate double chin. So there is something called Kybella. It works by melting the submental fat. I will warn you though, it does take at least 2 sessions for you to get to your desired goals, most likely. What foundation do I use? So I use Giorgio Armani Luminous Silk. I also have been really loving It Cosmetics tinted moisturizer, and the concealer I use is Shape Tape in color medium. Powder, I don't use a powder, but I probably should. Breast augmentation recovery process. So my size tips. So I am a 5'20", 485. I did go to work the next day. It was quite easy for me actually. However, everyone does vary in terms of pain tolerance, but for me it was really straightforward. My incision is underneath my breast, and my breast implants are underneath as well. Underneath the muscle. Tips is just healthy diet before and after. Go into it with realistic expectations. Trust your doctor. Trust the place you are going to. Don't look online too much because that really stresses people out, it seems. So that's my recommendations. Chin lipo versus filler to the chin. They are quite different. So chin lipo gets rid of, again, the submental fat. It's pretty straightforward, easy recovery process. Filler to the chin, it's usually actually done in conjunction or a chin implant. It gives you a little bit more projection to the chin, a little bit more length. Right candidate for nose fillers. So nose fillers, it usually is anyone that has a low bridge or they have a bump that they want to camouflage with filler, and then someone that wants their tip a little bit lifted. It looks great on pretty much everyone, and there's very little downtime, if any at all, and it lasts about a year on average. Nursing school. I went to Western University of Health Sciences. Profiles for BAM. So there's a lot of different brands, however, and they all have different names, but most common is high, moderate, low. I did moderate. I felt like it was the most flattering to my body type, and it is actually probably the most popular profile as well. How to become you? Well, everything I explained before, nursing school, work at an office, and just be kind and fabulous. Not that I'm fabulous, but just be kind. How do I make an appointment with you? By calling the office, that's the best way. Office is in my link. No, office phone number. My brand of white coat, this is Grey's Anatomy. I got this for like $25 on Amazon, and this is, I think, an extra small, petite. Chin slimming injection, that's done in the master with Botox or Dysport. It works very, very well, and it looks fantabulous. Most people need at least 20 units on each side, though. Tell me an embarrassing story. You know what, let's skip that one. I'm over that. Okay, tell me about yourself. My name is Joanna the Nurse. I am very happy. I am a mother and a wife, and I just love my life. I love my patients. That is it about myself. My diet, I love to eat, relatively delicious food. Gosh, sorry. I'm messing up right now, but basically I don't eat that much meat, I don't eat that much excess sugar, and I try not to eat too much dairy as well. However, I try not to limit myself, so I just try to substitute healthier options. Okay, working out, I'll be honest, I don't work out too often. However, if I were, I usually just get on my floor, I just do some sit-ups, do some squats, and then just go for it for about 10 minutes. Best filler, so really there is no best filler. Everyone's fillers. It's really what I recommend to you, what the patient wants to spend and what the patient wants, their end goals, and I'll give you my recommendation because there is a lot. So with that said, that is it from my book of Joanna the Nurse, and thank you guys all for watching, and please follow, subscribe, and just have a wonderful, fantabulous day. Thank you.